Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Breast cancer is the most commonly diagnosed cancer among women worldwide. What are the signs to look for? What happens when you get that diagnosis, and what treatment options exist, and how we can support those who are facing the battle? Now, whether you're someone who has been diagnosed with breast cancer, a caregiver, or simply want to learn more to support loved ones, this episode is for you. Dr. Madeline Camejo, Chief Pharmacy Officer of Baptist Health, and Dr. Diana Van Ostran, Breast Cancer Clinical Pharmacy Specialist at Baptist Health, are here with us, and they are on call. They're ready to answer your questions about breast cancer on this episode of Ask the Doc. I'm Kathy Buccio, and welcome to Ask the Doc, the show where we encourage our viewers to send in their questions anytime, at any place. So let's kick things off with a question from one of our viewers. Today's first question comes from Kendrick. He just reached out to us through our website, which is a way to reach us, please, for any of those questions we talked about on allhealthtv.com. And he wants to know, Drs. Camejo and Van Ostran, my wife Charlene and I just got married a few months ago. We're both 25, and some folks think we got married too young. But when you know, you know. Anyway, I want her to get a mammogram because breast cancer runs in her family, but she says she's too young for both a mammogram and breast cancer. I'd love your respective thoughts on this. Dr. Camejo and Van Ostran, is Charlene a lucky girl or what? Where can we get a Kendrick, right? Sounds like a great guy. But a great question to ask, especially as we're seeing more breast cancer cases being diagnosed earlier on, correct?
Kathy, I couldn't agree more, but routine breast cancer screening is really important for all women, but even more so for those who are at higher risk as your wife with a family history of breast cancer. For this reason, it is really recommended to get screening earlier than the average risk for women. So it would be important here for Charlene to visit like a high-risk breast clinic to get genetic testing done, identify her BRCA half mutational status, as if this will give her a better idea how often she'll need to get monitored. Just by the fact that she has a family history of it, puts her at a high risk. However, it also depends on the family tree and how close those relatives are really can identify the percentage of risk. And if she is deemed to be at high risk, then there may be additional recommendations for breast exams, mammograms, as well as even a breast MRI. So it's really important to identify the risk criteria here in order to create a good screening plan for Charlene. So glad you're thinking to being proactive and already thinking about this. So my advice for Charlene would be to make an appointment with a high-risk breast cancer clinic to really calculate her risk and go from there and make more an educated decision based on that fact. And to give some additional information, if there is no family history, then guidelines recommend that clinical breast exams 1 to every 3 years, starting at age 40, is when mammograms will be recommended annually. But the other thing I would also say, Kathy, is visit your gynecologist routinely for well visits.
Absolutely, Dr. Camejo. Those yearly checkups with your gyno are key. Now, heads up, docs, we've got another question, a paying question from Athena, who's reached out through our YouTube page. And she wants to know, Dr. Camejo, my mother, grandmother, and aunt have all had breast cancer and survivors. Thank the universe. As a result, I'm thinking of having a prophylactic mastectomy. The way I look at it, why wait for something that is probably inevitable? What do you think? Now, Doctors Plural, I read that Athena, the Greek goddess of war, was actually associated with strategic thinking and reason. And I've heard this from many women. What are your thoughts?
Hi, Athena. That's a really good question, and I'm glad you're asking it. You're being proactive about everything that you can do to reduce your risk of breast cancer, especially considering that you have all of those risk factors. Now, I wanted to go ahead and really highlight that really no surgery can completely reduce the risk of breast cancer to an extensive degree. However, there may be some breast tissue that may be left behind or be present in the lymph nodes, right? The lymph nodes, it's really the highway to the other sites of your body. So it could be a possibility that even after removing, both of your breasts, you can still get breast cancer after. So the risk is not completely removed, but it is significantly reduced. Having said that, prophylactic mastectomy does decrease the risk of breast cancer, especially in those people that have high-risk genetic mutations such as BRCA1 or 2. Current cancer guidelines do recommend consideration for surgical intervention in this patient population, both with BRCA1 and 2 mutations, which means it really means having a discussion with your physician to ensure that you're making the right decision for you. And it's not just the actual surgery per se, right? It's everything else that comes along with it. You might have to go for a reconstructive surgery of your, to add some breasts back once you have this done afterwards. And there's also additional consideration of a bilateral salpingo oophorectomy, which is removal of both ovaries and fallopian tubes, as these produce estrogen as well. And you can see there's lots to think about here, right? So really individualizing patient care and making sure that we're doing everything possible to decrease those risks is really key. There are additional options for breast cancer reduction as well. There's a medication by the name of tamoxifen that can be an option for you as well if you fit the description for this medication. Tamoxifen has been associated with an increased risk of stroke, and therefore, if you have a history of this agent will not be a good choice for you. But it could be a possibility, especially if you would like to avoid a double mastectomy, right? So there are many types of avenues that you can take in this arena. And really, to summarize, for your individual case, I would advise you start by going to a high-risk clinic. We actually have one at Baptist Health, and get that genetic testing done. That's really a good baseline, right? Because like I mentioned, if you do have that BRCA mutation, right, and you are BRCA positive, then that's going to put you at increased risk. And the guidelines do say that this is the patient population that has the most benefit from a double mastectomy and any other surgeries that you may need. Really, I'm wishing you all the best in this journey with a clear mind to make the best choices for you and your family, and really rely on the guidance of your healthcare team.
Thank you so much, doctor. Now we got another allhealthtv.com question. I love it. It's from Lucille, who asks, hi, Dr. C and Van O. My mom is 50 and found a small lump in her breast. She got a mammogram, and then she was told that it was likely a cyst. I'm someone who likes to err on the side of caution, so I'd like her to get a biopsy, which I've heard are highly accurate. Mom is pushing back, but should I pull out the big guns and guilt her into it? Now, I don't know what you mean by big guns there, Lucille, but I can't imagine getting a biopsy is a bad thing. Dr. Camejo?
And Kathy, I like to err on the side of caution as well. Now, if a cyst was seen on a mammogram, then a doctor may recommend a biopsy to further evaluate the mass that appears as either a solid, or is there the only other way for certain is you will use a fine needle aspiration, and a doctor will insert this thin needle into the breast lump and attempt to withdraw fluid from it. And then it will have a sample of the fluid for testing, and they refer that to the surgeon for follow-up. But in the event that no fluid is withdrawn at all, then your doctor will collect a sample of the tissue and will send it off to check for cancer. Now, my recommendations would be to encourage your mom to go for that biopsy and to follow up on the cyst, ensure that it's just a cyst. And in the event that there were to not be a cyst, and then earlier finding that it is breast cancer, the better the chances of curing it, the sooner you get to it.
Okay, this next one comes to us from Kenji, and it's our first Instagram question of the day. Hello, Dr. C and VO. My sister, Dahlia, who lives in Austin, just told us she has invasive breast cancer. We're obviously horrified about the news, but in an effort to be able to really talk to her about her condition, I'd like to confirm that there's only one type of breast cancer, right? Thank you so much, Kenji, and I'm really sorry for this diagnosis, but hopefully Dr. Camejo can answer this really important question for you. Dr. Camejo?
Yeah, and Kathy, you couldn't be more right. This really is an important question. And Kenji, I'm sorry to hear the news about your sister, and we're sending her good thoughts along your way. But I'm going to have Dr. Van Ostran, since you see many of patients in clinic, what would you advise, Kenji?
Yeah, thank you, Dr. Camejo. And so sorry your sister is going through this, but I echo Dr. Camejo when I say it's good that you're getting informed. That way you can be the best support for her possible. And No, not all cancers are the same. So this is a very complex system. So the most common types of breast cancer include ductal carcinoma in situ, which is a very early form of breast cancer. There's invasive ductal or lobular carcinoma, inflammatory breast cancer, as well as triple negative breast cancer, and much more rare types of breast cancers, as you can see here, Paget's disease of the breast, angiosarcoma, as well as phyllodes tumor. I wanted to really focus today more so on the more common types of cancers that might be seen in the general population, including ductal carcinoma in situ. And what this type of cancer is really a cancer that originates in the ducts of the breast. And it's kind of like an avenue where the breast milk goes over to the nipple, where the cancer has not spread into the breast tissue, stay in the ducts of the breast. Next, invasive ductal carcinoma starts in the cells of the milk ducts where the milk is transported. And this is really the most common type of breast cancer. Invasive ductal carcinoma is another type of breast cancer that starts in the milk glands, and this is where the actual milk is produced. Invasive lobular carcinoma is the lobules of the breast. Once we know where exactly that breast cancer originated, we need to find out how it looks. And for that, we need our friends in pathology. So after we find out, what type of breast cancer you have, which means where the breast cancer originated, we kind of have to see, how does the cancer behave? What is present in the exterior of the breast cancer? So that way we can identify how to target it appropriately. And most of the information on your breast cancer can be really found, like I mentioned, on a pathology report, which is sampled through a biopsy of your breast. Next, we really need to understand what makes your breast cancer unique, right? So basically, what fuels the breast cancer? Is it hormones, right? Is your sister's particular breast cancer hormonal receptive, which means it's kind of fueled by the hormones. There are additional biomarkers as well that are present in cancer cells, such as a HER2 biomarker, which is something that you might see very frequently. All of this really dictates therapy, both upfront and down the road as well, if needed. There's also genetic testing that your sister might go through in order to identify if she is a BRCA1 carrier. And the reason why we do this is because there are different medications that we can use, including olaparib, both up front while she's getting her treatment or potentially down the line, right? So it's important to understand these genetic components of it. Your oncologist will also send for molecular profiling testing to identify any additional biologic markers that we can use in order to treat your cancer effectively, both early on and potentially down the line. And really, other important questions to ask your sister is if her cancer is localized to just the breast, or has it come to other parts of the body, right? Has it gone to her liver or her bones? Because really in this arena, then we're going to be able to see if her cancer is curative intent or have we switched gears to prolong her life, right? Really, we have made significant progress in this area. However, the plan would now change more so, like I mentioned, to prolonging her life rather than curing the cancer. But as mentioned, we have made significant avenues here. The treatment pathways are different, both for early and curative breast cancer as compared to metastatic breast cancer. Also important to note that although metastatic breast cancer is not curable, there are many metastatic breast cancer patients, depending on the situation, of course, that can live very comfortable lives. And we have a lot of medications to treat this. Lastly, I wanted to touch on the triple negative breast cancer population, and there's many options to treat this patient population as well. I hope I was able to answer your question. I'm happy you're taking the time to learn about all of this, and I wish your sister all the best.
Thank you for being so thorough, Dr. Van Ostran. We've got another YouTube question. This time it's from Jensen. And Jensen asks, doctors, I'm pre-med and thinking about going into oncology research. Can you explain the different types of medications used to treat breast cancer, such as chemotherapy, hormone therapy, and targeted therapies, and what the potential side effects are? Doctors, I'm somewhat familiar with the traditional chemo and hormone therapies, but what exactly is targeted therapy? Dr. Camejo?
So Jensen, happy to hear it, that you're making great strides when it comes to cancer. And we have always welcomed a lot more researchers as well. But we've come a long way from traditional chemotherapy, which really affects every cell in your body. However, it's important to note that traditional chemotherapy is still the backbone of many cancer cares. Now, targeted therapy is kind of some of the newer ones are medications that actually attack specific targeted cells without harming your normal cells. And that often is better because it also has a lot of decreased side effects. Now, Dr. Van Ostran, what are the new treatments available today? And what are the things that you're seeing in clinic?
Yeah, thank you, Dr. Camejo. So this is one of my favorite questions, and I can probably talk about it for a very long time, but I'm going to try to keep it brief. We have come a very long way from chemotherapy, with traditional side effects of chemotherapy being hair loss, fatigue, decreased defenses, diarrhea, as well as nausea and vomiting, among others. As Dr. Camejo mentioned, we still see chemotherapy being present at the forefront of breast cancer treatment. However, there are many examples where we added targeted therapy or immunotherapy to chemotherapy, or we may use targeted therapy or immunotherapy alone, right? So this tends to decrease those side effects. An example of this would be trastuzumab, which targets HER2 on cancer cells, but there are others. Trastuzumab is very well tolerated as well, however, requiring frequent monitoring of your heart. Additional examples include many agents used in the metastatic breast cancer setting, including palbociclib. Another name of it is commonly Ibrance, which is an oral medication and is very often well tolerated with limited side effects for our metastatic breast cancer population. Further, we have another type of drug molecules that are coming into the market now called antibody drug conjugates. And these are really cool because it's basically an antibody with a little bit of chemo carrier and takes that chemo directly to the cancer, thereby avoiding other healthy cells and limiting the side effects. However, these do come with some side effects that can be similar to traditional chemotherapy and can sometimes often be difficult for patients to tolerate as well. So just because you're not getting traditional chemotherapy doesn't mean that there might not be side effects. Lastly, I wanted to touch on immunotherapy, which has made its way into breast cancer as well as many other cancers, and uses the patient's immune system to fight the cancer. One example is pembrolizumab, Keytruda. There are other targets as well, depending on your particular breast cancer and additional medications that can be used. However, important to note that it really depends on what type of breast cancer you have. Hormone therapy as well has been around for many years, and you will see that it continues to be the standard of care for all patients who have hormone receptor positive breast cancer. And these patients will continue to be on hormone therapy after they're finished with their chemotherapy. A patient who has completed their their chemotherapy might be on hormone therapy for an additional 5 to 10 years. I really urge you to go into oncology research and find more medications that either cure our patients or have decreased side effects with increased quality of life in order to have people live longer, fuller lives.
Thank you, doctor. Now we've got a really touching Facebook question here that I want to share. It's from Chewy, and he wants to know, ¿Qué tal, doctoras? Mi esposa Renata is into alternative medicine and stuff. She's about to start chemo for her breast cancer, and we'd like to know if she can take herbal supplements while on chemo. That's a great question from a very great husband. Dr. Camejo, I'm going to let you take this one.
And Kathy, I couldn't agree more. And Chewy, I love the fact that you're partnering with your wife on this cancer journey. And yes, I love this question, and the answer is quite complex. So it's really all depends on what type of chemotherapy your wife is on. You know, a lot of herbal supplements out in the market are unfortunately poorly studied, and it's a gray area depending on herbal supplement your wife wants to be on. Now, it's important to discuss with your oncologist or even your pharmacist before starting any herbal supplements to ensure that there is no interactions with your treatment, your current treatment, or receiving it that could either cause increased toxicities or decrease the efficacy of your cancer treatment. So now there has been a recent promising update on cancer guidelines that is consideration for adding ginseng to manage symptoms of cancer-related fatigue in patients who are undergoing cancer treatment. And if that cancer fatigue is something that your wife starts to experience, this may be an important option that you can discuss with your oncologist in conjunction with your pharmacist, seeing that there is some good evidence behind it. But generally speaking, however, I really like to recommend avoiding any herbal supplements during your cancer treatments to avoid any complications. And there are some cancer centers, including Baptist Health South Florida, that do give complementary medicine clinics, or what they call integrative health, and that can help patients navigate this gray area of medicine. So I'm wishing Renata all the luck and strength in the world as she embarks on this journey, and you support her through it. And make sure you always ask to speak to your clinic pharmacist.
Great information, Dr. Camejo. Thank you. And we got another question from Insta. This time it's from Carlota, who asked, hey, doctors, what are the most common signs or symptoms that indicate breast cancer? I think I noticed a tiny lump on my wife's breast. Does this mean that she has cancer? Lumps on the breast doesn't always mean cancer, but it's absolutely imperative to check. Correct, Dr. Camejo?
Yes, Kathy. And Carlotta, good on you for being aware of the changes on your partner's body. And you're right, Kathy, finding a lump doesn't always mean it's cancer. So signs and symptoms include a lump on the breast, any nipple discharge, skin changes on the breast, or even breast pain. You know, these are some of the signs that should prompt you to go to your gynecologist or your primary care physician to get a clinical breast exam, where you're likely to be referred to get an ultrasound or a mammogram to then receive recommendations as to what to do next, and maybe even a biopsy like we had talked earlier before. But all of those will be the indicate to rule out any malignancy, and that's really what you all need to follow, and make sure you get to that gyno as soon as possible.
All right, we got a lot of questions here. We're going to get to as many as possible. This next question is from Lamar, and he reached out to us on our own beloved website, allhealthtv.com. So you should really check out that site. I know I keep saying it over and over, but let me tell you, it's chock full of information and you're going to love it. So his question is, Dr. Camejo, as a former pharmacist myself, I love the fact that you and your team always reiterate the important role that a pharmacist plays in a patient's treatment and care. Could you explain how this works with breast cancer patients? Okay, not to play favorites, but this is a fantastic question. The pharmacist is such a crucial role in any health journey. So can you answer that, Dr. Camejo and Dr. Van Ostran?
Sure. Hi, Lamar. And I'm going to let Dr. Van Ostran actually answer, since she is that pharmacist in clinic, and she can give you a brief explanation on what she does during clinic time.
Yeah, thank you, Dr. Camejo. So as a pharmacist in the breast clinic, I work extremely closely with the oncologists and nurse practitioners to provide really the best care possible to our patients. I am the go-to for all medication-related questions in our clinic, review labs and make dosing adjustments on medications when needed, as well as counsel patients on new medications they are to start and follow up while they are on those medications already. Patients love the fact that they have a pharmacist looking out for them as well, and someone who they can really ask questions to always. Really, a pharmacist present in cancer care is a must, and it increases patient outcomes and satisfaction. I do a lot of behind-the-scenes work that also directly impacts patient care, including continuously looking at most recent updates for breast cancer guidelines to ensure our treatment plans are up to date, reviewing new medications coming into the market to ensure they are safe to use in our patients, and educating other members of the healthcare team. I love what I do, and I get to help and make an impact on so many people's lives every single day. I give patients my direct line, and that is something that is very special to them. There are good days and there are bad days, but I am there along for the ride for all of the days in hopes of making the unthinkable somewhat more manageable with a good support team behind you. Thank you for the question.
Thank you. Okay, Dr. Camejo, I have one more question, and it has to be a quick response. I know it's already time to go. Dr. Camejo, I'm a newlywed and not quite ready for kids. Having said that, I'd like to know if taking birth control increases my risk of developing breast cancer. I've heard mixed things about this and wanted to ask you for your advice. Can you give me a 15-second version there, Dr. Camejo? I'm
going to try, but currently there is no strong connection that has been identified suggest a connection between the average risk people during childbearing years to having birth control. So if there is something that worries you and you believe that there is even a small risk, then I would I would tell you to take options for birth control that include copper intrauterine devices that don't have, they're hormone free. Those are the things that I would ask for, but always go back to your gynecologist. I think it's an important thing to do and have a discussion on those treatments.
Thank you, Dr. Camejo. That's all the time we have for today. I'm Kathy Buccio, and I'll see you next time on Ask the Doc.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.